My name is Stephanie Walker. I was diagnosed with metastatic breast cancer de novo in July of 2015. De novo metastatic breast cancer means your first diagnosis of breast cancer is metastatic or stage 4. It wasn't obviously something you plan to hear. My husband, John, he's been in my corner the whole time. I have 2 adult children, Andrew and Tanisha. Tanisha's a nurse, so she knows and wants to be included in everything, whereas my son just wants the highlights, he doesn't want the details. And then my sister-in-law, Sarah, actually set up a Facebook group for me when I was diagnosed, and it was called Team Stephanie. That's where I get a lot of the emotional support. I worked as a on-call hospice nurse. We relocated back to North Carolina, had a new job, then I couldn't work, then no insurance. Then that's when you sat down and you think, how do people do cancer treatment with no income? So essentially, working 40 years as a nurse, paying into the system, I got kicked in the balls. I never knew anything about metastatic breast cancer and definitely didn't know another Black person that had it. So I seen that there was an organization that was having a spring conference regarding metastatic breast cancer called Living Beyond Breast Cancer. And I attended my first conference by myself, not knowing anybody. Coming to Philadelphia was actually the first time I've ever driven here by myself. It was a control thing, first of all, to be able to drive. It's because if I didn't like the people that I met or wasn't enjoying myself, I could make a mass exit, just go home. And when I walked in, everybody was so friendly and it was nice, and I'm thinking, this is a bunch of bull crap. People can't be this nice all the time, with somebody that, has a terminal disease. And then I entered the ballroom, and I'm telling you, the vast number of people that were there was amazing. Just to think that the majority of those people were living with metastatic breast cancer, not just living, I mean thriving.
I'll see you back in North Carolina.
I became an advocate because I seen that there was a need in my community. Rural eastern North Carolina, the numbers of women with breast cancer were higher than the average, and the death rate was even higher than the average. And it was like, well, I wonder why. Is it that they're not getting quality care? Are they not have access to care? Or is it, an education issue of screening? So I kind of jumped with both feet in. Instead of testing the water with the toe, I jumped into anything and everything that I could learn and take it back to my community. Advocacy work with Living Beyond Breast Cancer is amazing. They have been instrumental in projects that I have done with the Metastatic Breast Cancer Alliance. The Metastatic Breast Cancer Alliance sponsored the Become Project, and the Become Project stands for the Black Experience of Clinical Trials and Opportunities for Meaningful Engagement. A big mouthful. It focused on the experience of Black men and women living with metastatic breast cancer. It gets to the meat of why there is poor representation of Black people in clinical trials, less than 6%. So it's important that people that are taking the medicine are representative in the clinical trials. Black Women Speak, that symposium came from the Become Project. It wanted to address the number one issue. Why aren't the healthcare providers having the conversation with Black men and women with metastatic breast cancer about clinical trials? What's stopping you? If you get rid of your biases at the door, and if I can leave my BS at the door, we can have this conversation about clinical trials. Being an advocate living with metastatic breast cancer, I fell off the mountain when I was told I could not work anymore. It was more of hardship than saying, hey, you have stage 4 breast cancer. That didn't bother me. So having something to replace that with, to give meaning, like I'm doing something for somebody. That's what you do as a nurse. You do something for somebody else. And if I can talk to just one person and let them know that it's going to be okay, it makes it all worthwhile.